Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. I'm Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group's Warren Internal Medicine. In accordance with social distancing due to COVID-19 pandemic, I am hosting this show from the studio, and our guests will be joining us remotely via video conferencing. On today's show, we will discuss having a baby during the COVID-19 pandemic. According to the Center for Disease Control, pregnant women may be at a higher risk for becoming severely ill due to the coronavirus and may experience complications such as preterm birth. We'll also look at the hospital safety protocols in place to ensure the health of you and your baby during the delivery and recovery, as well as precautions you should take with your newborn. Our guests today are Dr. Marlon Schwartz, Chair of Obstetrics and Gynecology at Robert Wood Johnson University Hospital, Somerset, and Dora Goodwill, a registered nurse who's the Director of Maternity Services at Robert Wood Johnson University Hospital, Somerset. Thank you both for being here. First, let's begin by having the audience to learn a little bit about yourselves. Dr. Schwartz, you want to tell us a little bit about your background?
Sure. Yeah, I'm the chairman of the Department of OBGYN at Robert Wood Somerset. And I had gone to college and medical school at Wake Forest University, did my training at St. Barnabas in Livingston, and I'm in private practice as part of Lifeline Medical Associates. And my office is in Piscataway, and I do the full range of gynecology and obstetrics.
And Dora, a little bit about yourself also?
I'm Dora. I am the Director of Perinatal Services here at Robert Wood Johnson Somerset. I have over 20 plus years of experience in maternal child health. I also am an educator as well, and really been a nurse for over 27 years.
Understandably, expectant mothers have a lot of concerns at this time. They're questions about being pregnant during COVID pandemic. Dr. Schwartz, do you want to tell us a little bit about the risks for women who are pregnant now or who are considering getting pregnant now?
Sure. Well, in general, pregnant women at their age group who are generally healthy have the similar risk as the population at whole of getting COVID. Now, we know from other viral illnesses that when women get a viral infection, be it the flu or COVID or even H1N1, they have the potential to be slightly more sick and more likely, in very small instances, more likely to be in need of a respirator or for ICU admission. Now, the risk is very, very low, but the risk is slightly higher in someone who's pregnant. And interestingly, when you compare it to H1N1, which was 8-10 years ago, the H1N1 was more severe in pregnant patients than COVID is now. So their risk really is basically the same as anyone else in their age group. But if they do get sick and have symptoms, it has a very small chance of being worse than the average person their same age.
So in other words, what we're looking at is really just the regular risks of pregnancy itself and just a little add-on on top of that.
Correct.
And so for most women, the risks of pregnancy, you want to just even let the women know what the risks are and if they should be concerned or not. Yeah,
the main thing would be if you want to take your same precautions or what have you, but the risk of someone 25 who's pregnant getting this is really the same as someone who's not pregnant in 25. So you want to treat yourself like anyone else out there and just take the precautions that we'll probably discuss later, but also the precautions that are recommended by the CDC, the government, et cetera.
So again, we need to, as someone who's considering getting pregnant or a pregnant woman, we wanted to follow the CDC guidelines. We'd like to social distance if at all possible. If we can't social distance, wearing the mask and also washing your hands frequently and trying to avoid large crowds. So really, that's what both pregnant and even non-pregnant women in all of America should be doing at this point, is just following the current guidelines.
Correct. You follow the guidelines, use some common sense. I know some people who are pregnant are trying to really avoid going out altogether, but there are obviously downsides to not going out at all. So I think most of it is, common sense. And like you say, washing your hands, staying clean in that manner, using a mask or social distancing, and just using, try not to put yourself in high risk situations where you're likely to get it.
And again, if we do all of that, not only could we reduce the risk of COVID, maybe since we are coming into flu cold season, maybe we'll even reduce the risk of picking up cold, flu, etc.
Of course, I think we may end up having a better flu season than expected because people are going to be trying to prevent COVID, but every other disease is still out there that everybody seems to think went away like March 20th or something, you know. But all those diseases still exist, and then the season coming up, we have the allergy season coming up, then colds and the flu. So all those things are still in existence. So we have to kind of be careful with those also, because that can confuse you with what you have too.
And the other thing that pregnant women or women who are thinking about becoming pregnant is getting their prenatal care. Do you want to talk to us about how important it is for women who are expecting to get their prenatal care?
Yeah, that's obviously very important. It's always been an important part of having a good outcome and a healthy outcome for the mother and the baby. And so a lot of people uh, tend to put off doing any kind of preventative exams. And we know that's been a problem now with mammographies, colonoscopies, and everything else. But certainly prenatal care, while most people will probably have a good outcome, we have to pick up things early, be it diabetes, hypertension, fetal growth problems, et cetera. There's a host of things, obviously, that we have a whole, especially dedicated to, so that we can pick up these things early. So people should keep their appointments. Generally, you're seen like once a month in the beginning, and then more often as the pregnancy moves on. But there are things that we need to look at and examine to make sure that everything is going well and will continue to go well.
So let's talk about a schedule, for instance. So I've got a woman, he's 25 years old. She comes to my office as a primary care physician, tells me that she had the urine and is positive for pregnancy. So I'm now going to send her over to a board-certified OBGYN such as yourself, who is excellent in care. And so what is she going to expect when she comes into your office?
All right. Well, basically, in the first visit, we usually kind of confirm the pregnancy. Probably have an ultrasound at some point to confirm the due date, and then we would set them up for appointments. The first one, we do some general background blood tests, go over the plan for the pregnancy, what they should expect. There's genetic screening and what have you, and blood type, and a bunch of blood tests we do initially. There's usually an appointment once a month up until about 28 weeks, which is the third trimester starts. And in that time, there'll be an ultrasound that will screen what's called the nuchal fold, which checks for like Down syndrome. There's a blood test for the AFP, which is for spina bifida screening. And then usually another ultrasound around 20 weeks, checking for fetal growth, make sure there's no malformations or anything abnormal going on with the kidneys, the head, brain development, heart. And then there's a sugar test around 28 weeks, screening for diabetes. Then as in each appointment they come in, we're checking the urine, checking the blood pressure, measuring, listening to the heartbeat, measuring the fundus to make sure the size of the uterus, there's growth going on. And then as she moves along, in the end, we see them more often because there's more likely a chance of a problem as the pregnancy gets nearer to the end, whether it be preeclampsia, blood pressure issues, diabetes that we screen for, et cetera. So the last month or so, we usually see them like once a week in the office prior to when we expect them to go into labor or be induced or be scheduled for a delivery.
So again, very, very important that the prenatal care. And unfortunately, during this whole COVID pandemic, a lot of people had put off their prenatal care, which at this point is now that, especially since everything is open, it's time to make sure we get back to doing all the prenatal care.
Right, absolutely. I mean, I had some people always coming in throughout this. Others were doing like Zoom appointments, but the Zoom has obviously limitations. Certainly what we do, there's a certain degree of hands-on that must be done. And there's certain parameters we have to measure that we can't do from 10 or 20 or 30 miles away. So, yeah.
And then one last question. Pregnant women always ask, should they get a flu shot?
Right. And they should. There's no reason not to get the flu shot. And in fact, like I mentioned earlier, viral illnesses in pregnant people, if they get them, can be more severe and more likely to lead to very, very severe illness or even a death. So by having the flu shot, that will help prevent their chance of getting the flu. And certainly in the environment today, if you take that out of the equation, we have a better idea of what they may have if they do get sick or have flu or cold-like symptoms.
Thank you. Now let's move to, we're bringing the woman to the hospital, so let's get over to Dora. Dora, do you want to tell us what expectant parents, both the husband and wife, should expect when they come to the hospital to deliver their babies, and what safety protocols Robert Wood Johnson Somerset Hospital have put into place?
So thank you for welcoming to the conversation. When we do welcome our patients at the entrance, when they do come in, they will be screened at the entrance. We have screeners there asking questions about their symptoms if they've traveled to the COVID areas. Also, their temperature will be taken at the entrance. We will have more questions that we'll ask that has to do with COVID and the risk states and the quarantine and all the other different aspects to make sure that they're entering the building and they're not sick at that time. And they will also be given a mask along with their temperature being taken before they're either escorted up in a wheelchair or they're shown how to go upstairs. As far as visitors, their husband is allowed to come with the wife when they're in labor. They can stay. Once they do come into the hospital, they're not allowed to leave until discharge. So we do encourage the husbands to make sure they bring the baby's car seat with them, so because that's usually something that's left in the car. So they have all their equipment that they need to be comfortable while they're here with us till they are discharged later on to go home. We provide meals for the family when they're here. We're also allowed doulas to come in with the pregnant patient when they're laboring. They go through the same screening process like the husband, and they're here to also support the mother through the laboring process. In reference to cleaning our rooms, we're lucky to have a very diligent support service that makes sure our rooms and our equipment and everything around the hospital is kept at pristine condition. But cleaning frequently, when patients are leaving rooms, it's cleaned. The environment is wiped down frequently. Staff is wearing PPE, just as the patients are, cleaning our hands frequently, washing our hands, wearing masks as well. When moms do come in for regular pregnancy, if they are in labor, they do get a COVID test if they don't know their COVID status. If they're a scheduled case or a scheduled induction or a scheduled C-section, they are sent by their practitioner to the hospital ahead of time, usually 96 to 72 hours before their scheduled procedure to have the COVID test done. So upon arrival to the hospital, we have that on file. So we don't have to do the test when they're here. But if they do show up in active labor, we do a rapid COVID test that will be sent and we get the results on the day of. Other visitors are not allowed besides the two that I did mention, but we do provide meals for the patients and have 24-hour lactation support, and meals are here. Our doctors are equipped and nurses are equipped to care for these families.
The other thing they need to also understand, of course, is the fact that both the doctors, nurses, and everyone who is within the hospital also has to go through the same COVID screening as they enter each day into the hospital also. So they shouldn't have to worry about the healthcare professionals, the janitors, the maintenance people who are coming around to each room to do all of this.
Correct. We're all screened. Visitors and employees, patients, everyone is screened every day. You come in through, if you go out and come back in, you're screened again. So it's a process, it's a safety measure in place. We take our patient safety and ourselves and all of the community safety into effect, so we make sure everyone is screened.
Now, what happens if the woman tests positive for COVID-19?
So if they're positive for COVID-19, they are kept in a room, isolated in some sort. And we are making sure that we are protecting them and their baby as much as possible. We make sure that all PPE is worn, meaning N95, regular masks, hand washing frequently, gowns, and gloves for every encounter with the patient. The patient will be kept in the room, would not be allowed to leave and come back in and out of the room. So with the spouse, if they're there. We do check the spouse's temperature. So if the mother is COVID positive, we do also monitor the patient's husband or the doula that's there. We do check their temperature every 12 hours. So whether the mother is positive COVID or not, that's also another part of our routine. So they will be kept in the room, and PPE be worn at all encounter with staff and with patient. And patient is encouraged to wear a mask when caregivers are in their presence, just to protect them and to protect the caregivers as well, to protect the patients as well. They are kept in the room. When they do deliver, we do cohort mom and baby, unless mommy's symptoms are really severe to the point where they need a higher level of care. They are really kept in the room, and they will be moved to postpartum with a mask, isolated again in another room with full PPE and taken care of. And we give them the same support that we'll give any other patient. But we make sure PPE is worn, good hand hygiene, and we explain everything that's done and procedures that they may not be familiar with.
And Dr. Schwartz, what is the risk to the babies of the mothers who test positive for the COVID-19?
Well, once the baby is born, if the mother is positive, the baby can still be with the mother. We're really, as far as transmission from the mother to the fetus, we don't have any confirmation that actually happens. It's could happen, we would think, but so we will allow the patient to have the baby in the room. But if the mother's breastfeeding or with the baby, you would have the mother wear a mask to protect the baby from getting infected from the droplets which come from the nose or mouth. And like anyone else, if someone is positive or suspected to be positive, they should be 10 days without any symptoms and at least 24 hours without any fever, without being on medicine, which is the current protocol for any person, before they should be allowed to actually have interactions without the mask with their baby.
So again, the important thing is that even though the mother may be positive, we're still treating her and the baby almost as if they hadn't had it. The mother we're going to observe for any signs or symptoms of COVID-19, and the baby is going to still be allowed to be nursed, etc., by the mother in her room.
Correct.
So the bonding still happens, the lactation still happens, everything still happens. The only thing different is the mom is going to be masked, and everyone who comes in is going to be coming in wearing PPE just to ensure that the baby doesn't somehow get in contact.
Correct. Yeah, we're treating the baby as any other person, and but we don't want to restrict the mother from seeing her child. So we can allow that as long as the mother's taking the precautions not to spread the virus, as we would if you were living in the house and your wife was positive or your child was positive.
And the mother also is still allowed to breastfeed.
Correct. What we do with breastfeeding, there's really it's not known. Now, it's been like 6 months now. It's not really known or been demonstrated that it gets transmitted through the breast milk. And if it got into the breast milk, if it was in fact infectious. But what precautions can be taken there is, one, the mother wears a mask because the droplets, the baby obviously is very close to her mouth. Or two, if there's a concern or a fear of having the baby that close, we could encourage the mother to pump the milk so the baby still gets breast milk through bottles, and other people can feed the baby, or the mother still could from a further distance, still wearing a mask until she was no longer considered infectious or contagious.
Now, it's time for discharge. What happens at the time of discharge if the mother was positive?
You want to take that, Dora, or should I?
Yes, absolutely. So at the time of discharge, if the mom is positive, we do tell them, we send them home, they go home with a mask. We do tell them to stay home for at least 7 days after their fever is, subsided. Make sure they isolate themselves from others in the home if possible. Good hand washing, mask at all times when they interact with the baby, making sure that other people are not coming in and out of the home frequently, that they do not share household equipment with other members of the family in the house or even with their spouse. Frequent cleaning of the environment that they're in. Make sure they have enough household cleaners in the home to clean. Make sure that they cover their mouth when they cough or sneeze. And as I said before, frequent hand washing. If they have a physician visit or an appointment, we do encourage them to try virtual first, and ultimately they will be visiting their physician once their symptoms-free post 7 days. But that is some of the teaching that we do for our patients when they go home. Another thing I wanted to point out is that our infants to positive COVID moms are tested for COVID 48 hours after birth. So this way, we make sure that when they're going home, they sort of know the COVID status of their newborn as well.
So the good news is that if the mom is COVID-19 positive, basically we're treating her the same as if she was not a post-delivery person. What we're going to do is she's going to, again, social distance while at home, except, of course, for breastfeeding or pumping the baby. She's going to be masking herself to avoid contact or droplets going from her to other people. It's the frequent hand washing. It's basically the self-isolation of the 10 to 14 days. If she's having a post-hospitalization visit within that time, to possibly do that via Zoom and then follow up afterwards once she's no longer contagious to the doctor's office, deemed whatever's best for her and her physician.
Correct.
And the same thing with the baby is going to be monitored by the pediatrician probably the same way. If they need to be seen by the pediatrician or family practice person within the 14 days, they'll probably do it via Zoom. And then afterwards, it'll be based on what's the best environment for both the baby, mom, and the provider.
Yes.
Correct.
Now, prior to COVID-19, most people who are pregnant or considering pregnancy would come visit the maternity area at the hospital to see what it was like, so that they knew what was going to happen at the time of delivery. Because at that time, you don't remember a thing because of everything happening, and you've got the most beautiful thing in front of you, and so you don't even consider what's going on at the maternity unit. So now that we're in the midst of COVID and we don't have in-person tours, Dora, do you want to tell us about virtual tours or anything else that the Robert Wood Johnson Somerset Hospital is doing for patients who are considering coming to the maternity unit?
What we've had is put together a virtual tour for our families to review. It's on our website. It really does give an overview of our unit and some of the questions that they might have, how the layout of the land and how it is, and what we offer. And we also, for when the patients go home and for the community, we offer virtual breastfeeding support group as well. So we do have a virtual tour and a virtual breastfeeding support group that is available to the moms and our community that we serve.
So we're giving them support prior to and afterwards as best as we can during this COVID pandemic.
Correct.
And can you give us just an overview what other services are available at the maternity unit?
We have 20 bedded private rooms. We have 24 hours anesthesiology 24/7. So patients are able to get their epidurals, or if we have any kind of emergency cases, we have anesthesiologists available 24/7. We have neonatology here. Our NICU is open and available. We have neonatologists 24 hours a day, 7 days a week. And our OBGYN coverage is also offered 24 hours a day, 7 days a week. So our patients are welcome to come in at any time. They will be cared for no matter when or they present to the hospital. We have full support here 24 hours a day, 7 days a week.
With some of the best board-certified providers, doctors, nurse practitioners in all of New Jersey also.
Correct. We have, not to brag, but some of the best in personable care, and we really do take our patient safety and our patient's preference into consideration at all times.
Now, just like the blackouts that they had in New York, everyone was concerned about that there'd be a big influx of babies after the blackout. Now that we've had coronavirus, do you think that there's going to be a coronavirus baby boom?
I think there's going to be a coronavirus baby delay. But personally, in my practice, I see for the first quarter of next year fewer actual patients coming in who are due and expecting a baby than I did in the last couple of years. Now, also there was also economic issues going on as well, obviously in the spring. So I think people who are going to have a family are going to have a family, but it seems that they might be just pushing it back a few months till things kind of calm down a little bit. That's what I'm kind of observing in my anecdotal experience here.
And I would agree with you. In fact, there's a lot of, I've got a 30-year-old who was, even just getting engaged and thinking of a wedding date, that things are getting postponed, and therefore babies and pregnancy are being postponed longer and longer. So I absolutely agree with what you say.
Yeah, it makes sense. A lot of people are pushing off their weddings as much as they can, and engagements, like you say, and everything's being just pushed back like 6 months. So I think we'll have a boom in maybe the end of the next year.
So before we wrap up, what are points that you want to impress upon the audience about what all mothers should do to ensure their health and the health of their babies and successful deliveries?
Yeah, I think, well, first you got to keep things in perspective. I think we know a lot more now about COVID. And for the most part, people who are getting pregnant are young and healthy. And fortunately, this is one virus that seems to, if you can use the word spare the young, healthy people versus older or more susceptible people. So for the most part, they're going to be okay. And we've been through, worse and bad pandemics and epidemics over the years, and we'll get through this. And people need to just be smart and diligent. We have more treatments coming out now. Something came out from the University of Pittsburgh this week. There's vaccines on the horizon, so I think there's light certainly at the end of this tunnel. But it's also a good time for people to learn and practice good health measures, safety precautions that hopefully they'll teach their children and carry on throughout their lives, be it eating healthier, preparing food better, exercising and whatnot. So hopefully people learn from this, and everyone stays well, and we get on, and life carries on.
Dora, any final thoughts?
My encouragement is to encourage our patients and our public is to make sure we are wearing our masks and, practicing very good hand hygiene, because it's key, and keeping our hands away from our face as much as possible. But, like Dr. Schwartz said, we hope that everybody will practice these and encourage others to do the same, so that we can hopefully prevent this disease from spreading or becoming more of an issue in the long run.
Well, as both of you have been saying, we've really done a tremendous reversal since March. In March it was all over the place, and now it's pretty much, we've got it under much better control. As long as we follow the agreed upon public measures, we're hopefully going to keep it under control. By keeping it under control, we can start doing everything we've always wanted to do. We can get engaged, we can get married, we can have babies. Everything can be successful. The other thing that it shows is how important a good hospital such as Robert Wood Johnson Somerset is to have the baby in, have a terrific maternity unit, have people such as yourself helping to run it and take care of it. And even more important is how good it is to have terrific physicians such as Dr. Schwartz taking care of the pregnant women, so that they do have as best a chance and a best success of having a baby. So what basically it's telling us is public health is important. Most of the time we don't think about it. Hopefully at this point we are thinking about it. We are socially distancing whenever possible. We're wearing our masks if we can't social distance. We're washing our hands. We're cleaning tables and things like that. We're basically trying to do things that we really should have been doing prior to COVID-19. Hopefully by having the mask, the social distancing, we keep the flu as low as possible. People don't have as many colds, coughs. It's really just following the public measures that we should have been doing up until this point.
Yeah, you're right. It is amazing how many people haven't done some basic things like hand washing. It really is perplexing, but I think now people are really much more aware of it.
Well, thank you both for being here, and thank you
Thank
for
you.
all that you do to provide services to our patients.
Thank you.
Thank you for having us.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset's maternity services, please visit our website at www.rwjbh.org/Somerset.